Hi, my name is Sheri Burke. I'm here with International Patient Facilitators, and we're in Tijuana, Mexico. And I'm sitting here with our beautiful patient, Tina Shelton. Hi, Tina.
Hi, Sheri.
Okay. Tina's here today to tell us the story, her personal story of her triumph with weight loss surgery. Tina's also here today with a group of friends from Longview, Texas, and she's here supporting them on their weight loss journey. So I'm going to ask Tina a few questions about her weight loss journey. Tina!
Hi.
Tina, when did your journey begin? Let's talk about Tina, and let's talk about where did we first meet?
We met online, of course, through a friend of mine, Amy, and her husband.
Right.
Were going to have surgery. And
when was that? How long ago was that?
2.5 years ago.
So we're going back 36 months ago.
Mm-hmm.
Great. Okay. So here's Tina 36 months after her surgery. So your surgery date was?
March 23rd.
March 23rd, 2013.
13.
Okay.
Mm-hmm.
And when you started your journey, what did you weigh?
I weighed 315 pounds.
315 pounds.
Yes. Large.
And how was your health at that time?
It was not very good. I was on a steady decline. I was borderline diabetes. I had congestive heart failure, was just diagnosed with that. And so I was just on a downhill decline. And
were you taking medications at that point as well?
Yes.
Okay.
Yes. Yes.
Okay. So you knew it was time to do something about your health?
Absolutely. Well, I had lost my mother 2 years prior to that, and she was only 67, and due to that, that just kind of, made me decide that it's time to change my life as well. And so this is when I introduced Ken, or Ken told me that him and his wife were going to come over. That's when I said, I really want to learn about this. And he said, well, I can get you in contact with Sheri. And he did, and then that's when I started emailing you and driving you crazy.
Fast.
It was
really
fast.
I know
that really fast.
You know a patient when they're ready and they just want to do this and get this done, and that's what I felt. You'd done your research, you were tired, and you wanted to do something, and you wanted to take your health into your own hands, and it was time. It was time. So Tina makes the decision for the date of your surgery. We set it up, and you flew in on March 24th. And when you arrived at the airport, tell us a little bit about what happened and how it went.
It went really fast, real smooth. Got here, and they were actually waiting outside for us and loaded us up in a van and took us along the beautiful, the bay area.
Right along the border.
Yes, right along the border, and showed us all the ships and everything. It was so awesome. And then we come across the border, and
nobody stopped you. It went straight across.
Right across. It was so smooth. There was no, they waved at us as we come across, and welcome. We kept hearing welcome, welcome, welcome. And so 5 minutes later, here we were at Obesity Goodbye Clinic. It was amazing.
Okay.
And then once we got here, of course, the process was just fast and smooth.
Pre-op's done.
Pre-op's done. Everything. Maria was absolutely fabulous. We loved her. Yes, the nurse. She was fabulous.
She
is here today. I was excited to see that. When I had called you, I was like, "Are we going to get Maria? Is she going to be our nurse?" And so when we got, I just told everyone, I said, "You're going to love her. She's, she was so comforting." Of course, I had come by myself and was just in the dark, and my husband was with me, and I didn't know what to expect. And Maria just kind of took us in, and Dr. Rios, and everything's going to be good, and just relax. And
it went really quickly. Pre-op labs, and then straight into the operating room. The surgery takes about an hour, and then when you woke up, how were you feeling?
I felt great. I felt
great.
Of course, I was a little groggy because so excited to have the surgery done. It took a little bit more to put me to sleep, so therefore it took me a little longer to wake up.
That's great. That's great.
And so once I woke up, I walked back to my room, and
and then you were up and walking the next day.
Up and walking later that evening. Yeah.
And then 2 days you spent with us.
2 days.
2 nights released. And then which hotel did you go to? Stay at? Lucerna.
Yes. Lucerna. Yes, it was beautiful there. Absolutely beautiful.
We used the Grand Hotel, we used the Lucerna Hotel, we used a lot of the main hotels here in the area. And it's a great place to recover.
Yes.
It's just comfortable.
Very comfortable.
And then the next day you're back at the airport, and you're at home.
Dr. Rios shows up with a smile and loads us all up and took us back across the border. And that transition was very smooth. I mean, it was just right across we went.
So when you arrived back home, and just tell us about when you get home and how the weight loss journey was. I mean, I know that you were a big exerciser too. You took this very serious, and you were going to get the weight off. And how did that go when you got home?
When I got home, it was very easy. You know, I did everything by what I was supposed to do through all of the different rules. Yes, I followed them to a T because I was so scared. If you'll remember, I called like a week later and I think I had messed up, and you were like, "No, it's okay, it's okay." Right. I was like, "I've ruined myself," you know, just through everything, all the diets that I had tried. I just knew that even with the surgery, it wasn't going to work for me. So it was just getting my mind right. And wow, did it ever work? Look.
Okay. And so it started coming off right away.
It started coming off right away. I think in my first month, I had lost 40 pounds.
Your body was dying to lose weight.
Yes, you're absolutely. Yes.
And so you were drinking a lot of water. Did you start a walking program? You start exercising?
Yes, I started walking. Of course, at first it was just around the house and everything, and then outside. And then I think in 2.5 weeks, I actually started at the gym, but it was at a very slow pace, being 350 pounds.
Right.
I couldn't walk but like 2 miles an hour. And of course, you know.
But then you ended up taking Zumba.
Yes, and you became a Zumba instructor and did my first marathon, 5K marathon. I had surgery in March, did my first 5K marathon in that November.
And so your weight loss went very, very quickly for a year, and then you maintained.
And then I've maintained. You've maintained over a year now.
So your weight, you started 350, and now your weight is at
175.
Perfect, perfect. So what about medications? What about your health?
Nothing.
No medications.
No medications whatsoever. It was wonderful. Wonderful. They said it was very, when I was doing my marathon and my Zumba training all at the same time, I kind of had gotten to a little heart trouble, and that was because I was working out so much and become so dedicated. They actually said, you can slack off a little bit. Your body's going through such a large transition right now. Yeah. You need to slow down.
I watched that. I thought, Tina, slow down a little bit.
Because I was in the gym all the time and running, and then the Zumba and all of that.
You don't need to do so much.
But I was just so determined, you know, to do it. And
right attitude. So you have you have the magic chemistry. You have the right attitude, and you have the right energy you put into this, and you got back exactly what you put in.
Absolutely.
Like, you know, it's not a magic pill, right? If you don't do the work.
No, and even now that I'm out maintaining, you know, if I eat the wrong thing, then I can get on the scale and whoops, there's 3 pounds.
Well, you know what,
it's time to go back to basics.
You have a tool that you can say, okay, I know what to do. I know what I need to do to go back to where I need to be. And it makes it a lot easier to lose it. And so today, who's here with you today?
I have my cousin Tammy. She's here with me, and our receptionist at work. She's with us, and her mom and her sister.
So we have you plus 5 patients plus 1 husband here for support.
Yes.
And we're all from Longview, Texas.
Longview, Texas.
And we're going to follow this story to see these ladies, and we're going to go back to Longview, Texas in 6 months, and we're going to see the progress everybody's made.
Yes.
And so we have a date before you leave. On Saturday, Sunday, we'll have a date set for the next seminar.
Wonderful.
And then we'll also make an organization for Shreveport, because we're going to Shreveport and to Dallas.
Yes, we're going to take them by storm.
Yeah, we're going to show people how they can take control of their health and how they don't have to suffer.
No.
I mean, it's still work, right?
A lot of work, but it is an easy process.
Yeah.
You know, things just went so smoothly, and in the back of my mind, it was hard because I was, okay, this went so easy. Am I really going to be able to do this? But the tool works for you, you know, but then you have to work the tool as well. You know, in the beginning it's easy, and then as your year approaches, it becomes, then you have to work the tool. So it's just amazing.
So this is a really wonderful video that I wanted to share with you, because you have a great living proof about bariatric surgery and the success you can have with it if you work your tool. And we can't wait to see Tina and her family and her friends in 6 months from now. And hopefully we'll post this video right after. Yeah. So thanks a lot for sharing your story, Tina. And we have a big day ahead of us and lots of surgeries.
It's wonderful. Thank you.
You're welcome. Thank you so much.
Yes, y'all come to Tijuana or Cancun with Dr. Verboonen.
We can meet in Cancun too.
Yes, absolutely.
Thank you.
Thank you.